So it's my pleasure to talk to you today about the addition of idelalisib to a standard chemotherapy regimen, bendamustine and rituximab, compared to bendamustine and rituximab plus placebo for patients with relapsed and refractory chronic lymphocytic leukemia. As you just heard, despite the excellent, exciting results, this is a relapsing disease, and new treatments for patients in relapse are important. Idelalisib is a first-in-class PI3 kinase delta inhibitor that has been previously approved for the treatment of chemo for patients with CLL who are not candidates for chemotherapy, treatment in combination with rituximab. This study asked whether idelalisib could be added to a standard of care in the relapse refractory setting, and that is the combination of bendamustine and rituximab, and whether there would be an improvement in progression-free survival, which was the primary endpoint. The study enrolled 416 patients, and there were 207 patients in the Idela arm and 209 patients in the bendamustine rituximab arm. The reason for over-accrual compared to what's on the slide is when you say stop, you always get a few extra patients. So the numbers don't exactly add up. There was a pre-specified interim analysis when 67% of the events occurred. That interim analysis occurred in mid-October, and at the recommendations of the Independent Data Safety Monitoring Committee, it was recommended that the study be stopped and that the results be made public because of an overwhelming benefit for the addition of idelalisib to the conventional arm. Patients were stratified for the presence or absence of abnormalities of P53, IGHV mutation status, relapsed refractory disease. The primary endpoint was progression-free survival. However, important secondary endpoints, including overall response, nodal response rate, overall survival, and complete response, were analyzed. This is the primary endpoint of progression-free survival. There is a highly statistically significant improvement in progression-free survival from 11.1 months to 23.1 months. The 11.1 months in relapsed refractory CLL is very consistent with what we would expect for bendamustine and rituximab, and so this represents a substantial increase in the progression-free survival. If we look at the various risk groups that we know in CLL, that this benefit was seen across risk groups for progression-free survival. Importantly, one of the key secondary endpoints was overall survival. It's nice to be able to have people in remission longer, but it's key for that patients live longer, and the addition of idelalisib to bendamustine rituximab resulted in a significant improvement in overall survival compared to the control arm. This was not without toxicity. Virtually all patients in both arms experienced treatment-related toxicity, but serious adverse events were more common in when the idelalisib was added to the conventional bendamustine rituximab arm, and there was more discontinuation of study drug in the idelalisib plus bendamustine rituximab arm. If we look at the combination of idelalisib plus bendamustine rituximab, this was superior to bendamustine rituximab alone. There was a 67% reduction in the risk of progression or death. There was a 45% reduction in the risk of death from relapsed refractory CLL. The results were consistent across risk groups in CLL. The safety profile is consistent with what we know from the agents bendamustine rituximab and idelalisib, and therefore idelalisib plus bendamustine rituximab represents an important new option over a standard of care bendamustine and rituximab.